I think you're all really aware of these figures, and also in recent days, these figures are now really underestimated and not able to be updated because of what's been going on in Gaza. So that kind of the last update we had that was officially confirmed was over 11,000 fatalities. 40% of fatalities are children. It's also important to say that a large proportion of families have been affected, so multiple casualties within the same family, multiple deaths within the same family, and they've talked a lot about families being wiped off the civil registry because obviously it's a culture where there's multi-generational households. Also something that has been I've been hearing in meetings as well is that there's an unusual the proportion of deaths to injured is unusually high for this in this conflict compared to previous conflicts, and as Professor Maynard mentioned, there's also a significant number of people who are still missing, including a large number of children. It's impossible to rescue those people from under rubble for numerous reasons. It's unsafe. There's no fuel for the machines that are usually used. So so it's really a dire situation. I think everyone's also really aware of the kind of health statistics in Gaza by now, so almost 200 deliveries a day. There was also a UNFPA report, I think last week or the week before, that said that there more and more women were coming forward and asking for abortions because of what's going on. And I think people have seen all the publicity around the incubator dependent preterm babies and how some have been taken off or taken out of the incubators already. And there's some conversations going on between Gaza and Israel about whether those babies can be provided incubators or evacuated, but nothing's happened. And the other thing somebody mentioned about mental health. So prior to October 7th, there were 485,000 people living with moderate to severe mental health illnesses. And now the entire population is living with mental health stressors, including bombardment and siege. Obviously, this slide was made last week, so even then there were critical shortages of blood and drugs and anesthetics. I think has been well publicized that there are operations being carried out with just kind of what are traditionally more sedative type drugs without a full anesthetic. And that's even deteriorated much further since then. One thing that isn't talked about a lot on the news is the risk of outbreaks. So obviously there's a first wave of killing through the bombing. There's also been with the webinars with the doctors in Al Shifa Hospital talking about the high rate of wound infections, very high rates of antibiotic resistant wound infections as well. The fact that they can't do the normal operations that they would do in as the first stage because they've got so many casualties and limited supplies, and so people, particularly children, are going to have kind of many years of ongoing treatment and so on. But it's also important to acknowledge that the area that was ordered to evacuate and has undergone the heaviest bombardment was the heaviest populated, and so the area, the Gaza Strip, which is already one of the most densely populated areas in the world, has become even more so, coupled with very limited access to water, to adequate sanitation, and already doctors were reporting presentations of infectious diseases, and there's the risk of huge outbreaks of diseases, which includes potentially fatal diarrheal diseases. So that's a huge issue as well. There's also the issue of withholding of food or starvation being used as a method of warfare. And I think it was previously mentioned about even during the siege, you know, the Israelis would or the Israeli state would calorie count how much people are allowed to have. So it's this idea that you can survive, not thrive. This has obviously been massively exacerbated now with the huge kind of cut of ingoing aid and food, water, fuel, or electricity. It is against international law to use starvation against civilians as a method of warfare. So it is absolutely a war crime without any discussion. It's also important to remember that Gaza was hugely dependent on aid before this happened. So it was about 450 to 500 trucks of aid going in daily. This was a report from kind of late October, saying that prior to the escalation of Israeli attacks after October 7th, there would be one truck of aid entering every 14 minutes, and now it's one truck every 3 hours and 12 minutes, and obviously that's even dwindled further. Existing supplies are running out, bakeries and supermarkets have been destroyed, commercial imports are not allowed in at all, and some of the food aid that is allowed in can't be used because people don't have water or fuel to prepare them. And this is on the background of also the fishing industry having been destroyed, as was already alluded to, the agricultural the impact on agriculture of being able to not maintain your crop production, not maintaining your livestock. So many of the kind of agricultural practices have been affected by the electricity blackout. And then even when you have resources available within Gaza, it's difficult to deliver them. The person in Gaza that I'm in contact with talks about queuing for 4 hours a day, and it's up to 6 hours a day, and that's to receive about half of what you would normally receive. And obviously that there's it's been well established, this looks like a war on children and a war on healthcare. So there are attacks on healthcare, and we've talked about the huge death toll amongst health workers, including health workers in duty, and the huge death toll amongst humanitarian workers as well, and the majority of hospitals being non-operational or partially functioning. And this was a statement by the executive director of WHO's Health Emergencies Programme. I think it speaks for itself, but essentially he's saying it's inhumane to leave Gaza's health workers with the dilemma of caring for their patients or leaving to save their own lives, and healthcare should never be a target. And we've seen so many heroes on our televisions, but healthcare workers shouldn't have to be heroes. They're human beings with families, and often they're working insane shifts and going home and then being killed with their entire families. Mohammed Al-Habil, I think some people on the call may know him. He was stationed in Oxford. He's a fourth-year medical student from Palestine and grown up in Gaza. And he was interviewed on Good Morning Britain. And he literally went home less than a month before these kind of escalation in Israeli attacks started, and he said on Good Morning Britain that what we truly want is a ceasefire. We're being killed, we're being targeted, we're so afraid. And what he said, that what he asked of the international community is to go on a protest, to go on a strike, to go on a march, put true pressure on the governments to stop this, to force Israel to stop this. He also talked about the fact that his faculty building has been damaged, that he's lost fellow students and some of their teachers, that they all worry about their future as students as well. And that people, I think a lot of his fellow students thinking that when the Rafah crossing is open and they're able to leave, a lot of them are thinking whether they can leave and go elsewhere to complete their studies. I just wanted to mention something about the humanitarian pause, which we hear so much about. And to be honest, myself, I work in the humanitarian sector, and I'd never heard this phrase humanitarian pause before this latest escalation in violence. Obviously, what we hear many times is that you're just stopping momentarily to feed people, and then you're going to bomb them again. Oxfam, I don't work for Oxfam, by the way, but they have published an excellent article talking about the main reasons why talking about humanitarian pause, about safe corridors, safe zones, etc., is not the answer, and why we need a ceasefire. So essentially, international law means that we shouldn't need things like pauses, safe zones, and corridors in the first place, because humanitarian aid, humanitarian facilities, places where things like food and other humanitarian aid supplies are stored should not be targets anyway. Corridors and pauses are often fragile, they're often ignored, and then that can make things more dangerous. So, and often communication is not very clear in this situation, so it may be confusing, and so civilians may get the wrong messages and venture into areas that are actually not safe. So it actually increases the risk. Also, pauses are often used as an opportunity for the warring sides to rearm. So it often isn't really in the long term creating more safety for civilians. And also, history makes Palestinians fear this talk, because they worry that they may be allowed to leave, perhaps cross into Egypt, and then never be allowed back. So it's important to understand with all of this the historical context of this. For anyone who's not an SHA member who happens to be on the call, we are an affiliate of the Labour Party, and our position. So we've released a couple of statements that you might be aware of, and the most recent one included this phrase. So we urge the Labour Party, to whom we are affiliated, to speak out clearly and unequivocally for a ceasefire and a just peace. And then we refer to previous work that was done by Mo Molam in building peace in Ireland, and this is the calibre of leadership which is needed urgently. And then the design is some stickers that I believe were designed by Mark Ladbrook, our chair, and these are available. This is a leaflet also that's available that shows our first two statements that we released. Just wanted to highlight a couple of points. One is that we are calling for peaceful and equitable resolution to the conflict, which will obviously bring safety and security to everybody in the region, and which can only be achieved by addressing all root causes. So that's really important, again, embedding this in its historical context. And also that as SHA members, we as SHA Central Council do fully support and encourage our members and branches to support solidarity actions for Palestine, whether they are marches or other fundraising events for medical aid for Palestinians, perhaps IMEU, which Professor Maynard mentioned, or any other public meetings. And please be visible, and please speak out where you can in all of the spaces where you are. This is some of these are the stickers that you can get if you're going on a march or a demo or another event and you'd like to do that. We've got the QR code here for medical aid for Palestinians. I'm happy to share these slides so you can have these resources and the links. As Mark mentioned, there is a debate in Parliament, in the House of Commons tomorrow, which will include at least one, if not two amendments to the King's Speech around calling for a ceasefire. One is brought by the Scottish National Party, and one is brought by Zara Sultana and Afsana Begum, and signed by some other MPs. So if you haven't done so already, please write or WhatsApp or message your MP and ask them to support any amendments that come up tomorrow with regards to ceasefire and in the future. Also, please write to your councillors. The council that I'm from, about 70% of our councillors signed an open letter calling for a ceasefire. So it's really important that we are in this position of being an affiliate of the Labour Party, that we do use that position to try and influence their position from a more humanitarian stance. I think as one of our speakers is going to talk more about the Labour for Ceasefire Now campaign, which was just released today and just launched today. If you haven't joined and signed up already, please do. We are endorsing this campaign, so please look out for more in the future, and look out for more webinars on this topic as well. Do organise locally, be visible as SHA on marches. And just to finally say a little bit more about International Health Working Groups. So if you're interested, please contact me through the SHA, and this has become our kind of primary focus for now. But before this, we were looking at supporting medical aid for Bhopal, because their 39th anniversary is coming up at the beginning of next month. And there's also a piece of work going on around decolonizing aid. And we're welcome to hear your ideas about how you'd like to get involved. Thank you.